Moving on now to the knee and the lower leg, joint structures as well as soft tissue that we need to learn for the Sports 4 diploma. The first bony landmarks of the knee and the lower leg is going to be the tibial plateau. The tibia bone forms a sort of flat plate or plateau as it attaches and articulates with the head of the femur. So this is known as tibial plateau. So the upper, medial and lateral joint margins of the tibia form that flat plateau. You can see in the picture exactly what it looks like. And then we've got the patella. So we need to understand that there are superior poles of the patella and inferior pole of the patella. So the superior pole is, as it suggests, it's the upper surface of the patella, and the inferior pole is the lower surface of the patella. The picture that you can see there of the patella gives you a few other bits of information, bony landmarks like the lateral facet, medial facet and the odd facet, but you do not have that in your syllabus. So what you do need to know is about the tibial plateau, the superior and inferior poles of the patella. I thought this was quite a good picture of the inside workings of the knee. I think if you look at diagram A, you can see very clearly what the patellar surface of the femur would look like without the patella on the top of it. And you can see the anterior cruciate ligament there, which is quite difficult to find because it's right in the middle. And the lateral collateral ligament, you can see there on the outside of the knee. The lateral meniscus, you can see just a slither on the diagram of the meniscus, and the head of the fibula. So coming to the middle of the diagram, you clearly can see the femur, you can see the posterior cruciate ligaments, the medial meniscus, it's that thin little slither there, and the medial collateral ligament. You can see quite clearly on the medial outside edge of the knee. The patellar ligament is quite interesting. That goes down underneath the patella and then comes out and attaches underneath. And then on the right hand side of picture B, you can see the lateral condyles of the femur, the anterior cruciate ligament, the lateral cruciate ligament, the lateral collateral ligament rather, and the lateral meniscus, as well as the head of the fibula and the interosseous membrane, which is interosseous means I'm in between the bones. And we get membranes between most of the bones, interosseous membranes. So I thought it was just a good diagram to give you a good idea of what the inside structure of the knee looked like, which we can't see or necessarily palpate. The bony ends of the femur are called condyles. So the lateral and medial femoral condyle, that is the bony lumps at the end of the femur that attaches to the tibia. We have the tibial tuberosity. Now that is the name of the top lump, as it were, on the bone of the tibia. So that's known as the tibial tuberosity. Then we have the anterior tibial border, which is what is written on the tin. The lateral and medial femoral epicondyle. Now, an epicondyle is the bit you can feel sticking out. An epicondyle is a rounded projection. So whereas the condyle is what is underneath and attaches and articulates with the head of the tibia, the epicondyle sticks out a bit so you can feel the epicondyle either medially or laterally. We also have the adductor tubercle, and that is a little lump in the bone where the adductors attach. And we also can see the head of the fibula, which slips in there and sort of fits inside right next to the tibia. Pes anserinus. This is the point of attachment which can be found below the knee, and it's where the three muscles, the sartorius, the gracilis, semitendinosus, attach to the anterior-medial surface of the tibia. So you can actually feel it. It's on the medial side, just below the knee, and if you palpate it or friction the top of it, it's often very tender. So it's at the front and on the inside, so it's anterior-medial surface of the tibia. And this is where your sartorius, gracilis, and semitendinosus attach. So repeat after me, pes anserinus. Moving on from the bony landmarks, we're now going to have a look at the ligaments attached to the knee. So we've sort of seen some of them already on the diagrams we've had earlier, but the ligaments we need to know for the knee are the lateral collateral ligament, commonly known as the LCL, the medial collateral ligament, known as the MCL, the anterior cruciate ligament, the ACL, and the posterior cruciate ligament, PCL. So repeat after me. Lateral collateral ligament, medial collateral ligament, anterior cruciate ligament, posterior cruciate ligament. So the collateral ligaments can be found on the outside of the knee, and the cruciate ligaments are on the inside, and they tend to cross over. Moving on, we're going to discuss the menisci that we have on the knee. So a menisci is made out of fibrocartilage, and it's a sort of rubber-like structure. It helps with the stability of the knee. The knee is probably one of the most unstable of the joints. It's a very busy joint. It's very easy to injure the knee. And the meniscus or menisci, we have two semicircular meniscus. One of them is a medial C-shaped larger meniscus, and then we have the lateral meniscus, which is a circular smaller meniscus, which is on the inside. So that's the knee menisci, medial and lateral meniscus, the medial being the larger of the two. So we're going to have a look at the patellar tendon. The rectus femoris muscle comes down, which is obviously one of the most superficial quads, comes down the whole length of the thigh and then attaches to and turns into really the patellar tendon. And the patellar tendon is a ligament that attaches to the bottom of the patella and the top of the tibia. So this tendon runs underneath the patella and attaches that rectus femoris to the lower part of the knee on the bottom of the patella and on the top of the tibia. So say after me, patellar tendon. We also have bursas in the knee, quite a few bursas. We have the popliteal bursa, the pre-patellar bursa, the suprapatellar bursa, the superficial bursa, the deep infrapatellar bursa, and we also, as a bony landmark, have the pes anserinus. So we do need to know an idea of where these different bursa are. And reminding you that bursitis is inflammation of a bursa. So here we have a picture of the suprapatellar bursa. This is an extension of the synovial membrane, more of a pouch than a bursa, rather than that sort of cushion. We have the pre-patellar bursa, which you can see quite easily on this picture. The deep infrapatellar bursa, and which is under the hamstring tendon. So this is just a sideways view of the bursas as well, just to give you a good idea of where they are.